life. Check out our headline news service to learn more. Tune in here for National Native News.
Weekdays at 5:55 on KSJE Farmington. KSJE is supported by the Family Crisis Center, presenting an important conference about human trafficking, Wednesday, May 29th at the Farmington Civic Center. The conference is free. The goals of the conference are to bring awareness to the community about sex and labor trafficking, identify significant indicators of human trafficking, and provide help for those who may have experienced trafficking. Law enforcement, counseling, social work, nursing, or those in the legal field are encouraged to attend. Find out more at FamilyCrisisCenterNM.org. Eleven minutes past 8 o'clock. It is Thursday morning, the 23rd day of May, 2024. Good morning, everyone. I'm Scott Micklin. Thanks for tuning in to KSJE 90.9 FM, over the air, of course, here in San Juan County, New Mexico. In Durango, Colorado, you can listen to us at 103.3 FM. And if you're anywhere else on the planet, you can always listen to us from our website, streaming all the time, KSJE.com. Want to welcome our viewers as well. Video of the program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everyone. I'm glad that you are with us. Coming up today, my guest from the San Juan County Partnership. We're going to be talking about alcohol and alcoholism here in San Juan County and seeing some of the trends that are going on in that regard. That conversation begins in the next few moments right here on KSJE Today. Then, of course, we're going to continue our Candidates on the Air segment, and my apologies, that is not Sam Gonzalez's picture on the screen, but Sam Gonzalez will be featured today at 8:50 a.m. as part of our Candidates on the Air feature. He is running, of course, as a Republican in San Juan County Commission District 5, so stay tuned for that. Mick Hess is going to take us roving with the arts after the news at 9:06 a.m. right here on KSJE, and we invite you to connect with us on X and Instagram in addition to Facebook and YouTube. And if you're a podcast person, you can subscribe for free to check out KSJE podcasts. They are available at places where you're probably already listening to podcasts. So check it out. Discover a new local program that you may have missed recently. Outside our studios here at San Juan College, it is currently sunny and 56 degrees on this Thursday morning. We're expecting a mostly sunny and breezy day today, the high 76 in Farmington. Clear skies tonight, the low 48. Tomorrow, sunshine again, 76 for a high, sunshine 71 on Saturday, but we're expecting some winds, a fire weather warning in effect for Saturday already, so those high winds will be around. On Sunday, sunshine with a high of 73, sunny and warmer on Monday with a high near 80 degrees and mid-80s with sunshine by Tuesday. I'll be back with my guest from the San Juan County Partnership right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The most important ingredients to sustaining health and wellness are the resources and tools that help you live a vibrant and healthy life. At San Juan Regional Medical Center, the goal is to promote health by making sure those resources are available. Find the path to the best life at lifebetterhere.com. San Juan Regional Medical Center. Better is our mission, improving lives through personalized health and care. KSJE is supported by the Family Crisis Center, presenting an important conference about human trafficking, Wednesday, May 29th at the Farmington Civic Center. The conference is free. The goals of the conference are to bring awareness to the community about sex and labor trafficking, identify significant indicators of human trafficking, and provide help for those who may have experienced trafficking. Law enforcement, counseling, social work, nursing, or those in the legal field are encouraged to attend. Find out more at FamilyCrisisCenterNM.org. KSJE is supported by the River Reach Foundation, presenting Riverfest this Memorial Day weekend in Farmington. Music, crafts, food, and more can be found along the Animas River trails in Farmington. Riverfest kicks off Friday afternoon, May 24th, and continues Saturday and Sunday. Celebrate the rivers in Farmington with this jolt-worthy event. Find out more online at riverfestnewmexico.com. Riverfest presented by the River Reach Foundation. And back in Studio A this morning with my guest, as I mentioned, from the San Juan County Partnership. Back for our monthly visit with the partnership. Amanda Evans is here. Good morning. Welcome back to KSJE. It's good to see you.
Good morning. It's always great to be here.
Thank you for coming in and talking about a big event that you have coming up next month. So we want to share some details about that and also some of the data kind of behind this big event, right?
Right. We're going to do an alcohol town hall in June, and want to come on and let people know about it today, but also kind of share why we think it's a concerning issue and want to talk about it.
Okay, very good. Well, let's do that and talk a little bit about some of those things. You said it's going to be on the 11th of June?
Yes, June 11th. It's at the Boys and Girls Club in the evening, so people can make it after work, hopefully. We know that there's no time that'll work for everybody, but we want to make it as open to the public as we can, so it'll be at 6 o'clock.
Okay, very, very good. And I'm just updating your name because apparently somebody was a little asleep at the switch here this morning, Amanda, and my apologies. So we're just doing some updates here as we're on the air. But this is open to anybody in the community, I guess, to learn more about the issue of alcoholism in the area?
Yes, it's open to anybody who wants to attend. We're going to have some speakers that can present on some of this information, and then we're going to have some personal stories from local community members on how they've overcome and dealt with alcohol issues in their own lives. We're going to have some resource booths that are available for people to talk to if you have an issue yourself or you know someone who might, how they can get some help in the community.
Okay, very good. And I'm showing the first page of some information that you provided to us from some of the data that you collect with the San Juan County Partnership. And so these are some of the local data from San Juan County that we can see. So radio audience, if you're not watching the video, you're missing out a little bit, but we'll try to explain kind of what we're seeing on the screen. But these are alcohol and consequences here in San Juan County.
Right, and so this graph is talking, and these numbers are talking about alcohol-related death rates. And so what we see is a concerning trend because it's going up since 2015. So we're always kind of a year or two behind with data because it takes about a year to a year and a half to kind of get data back to us from the sources it comes from. So This is only through 2001, but if you see it's kind of an upward trend, it's almost, well, it has doubled. 85 to 169. So, that's some pretty big numbers that we're dealing with, especially when we're talking about death rates.
Right, exactly. And these are deaths, age-adjusted rates per 100,000 people,
Yes.
I guess, is what we're looking at, right?
Yes.
And so that's what has been doubling since 2015.
Yes.
And so, and you note here that in 2021, there are 199 alcohol-related deaths in San Juan County, and that to me seems like a lot
Yes.
for the size of the population of San Juan County.
It is. And if you look kind of in the lower part, it shows how we compare to New Mexico and the United States as a whole for those same kind of death rates. And we're, much higher than New Mexico and a lot
way much higher.
way much higher than this United States as a whole. So
right. So for comparison, per 100,000 folks in 2021, we're at 169.3 in San Juan County. Statewide in New Mexico, it's 103, and then nationwide, it's 41.
Yeah.
Is it? So we knew that New Mexico was higher than the national average, but we're even above that.
Yes.
So that's the issue, and that's, I guess, why organizations like the San Juan County Partnership want to focus some of your attention on this problem, especially here.
Right. We want to have some community discussion on, what are we looking at as a community and what are maybe some solutions. There's some groups statewide that are working on different issues like raising the alcohol excise tax, which means the people who are actually affected by alcohol are the ones paying for some of the services that end up happening. So that's, there's different tactics that groups can use to kind of prevent some of this on the front end. And that's some of what the partnership does, is really look at how are we addressing this before people even get started using alcohol, or how can we kind of negate some of the effects and reduce the harm that's going on.
Right, the whole prevention side
Yes.
of things, which
Yes.
is part of your name, and that's what
It
you all
is.
do and live, breathe, and advocate for
Yes.
all the time. And so that's really important. And I guess the other important part that you mentioned too is how to pay for some of these things.
Yes.
And it seems like, increasing the excise tax on alcohol, or a tax on a drink at a bar or restaurant or things like that probably might be a way to do it, like a user tax, if you will, or a user fee. Folks that are using alcohol or drinking it, pay for the services for those who maybe have a problem with it.
Right. And so that's really a more fair way of kind of getting money for some of those services that we're already paying for. As a state, we've already got money going into some of these consequences. So it makes more sense if somebody's not buying alcohol and not using, that they shouldn't be paying for some of those consequences for someone who is.
Right. Very true. Very true. When it comes to binge drinking, there's some other data out there we want to share as well this morning.
Yep.
Here it is. Of all the deaths in San Juan County, 12% are alcohol related.
Yes. Yep. And so 12% can, that's didn't always sound like a lot. It's not like it's 80 or 90%, but when we're talking about deaths, we'd hope it was zero related to alcohol, but because there are ways to use alcohol responsibly. That's one of the things we at the partnership always say is, we're not telling everyone not to drink. We're not telling the responsible 22-year-old that's legal, doesn't drink and drive, isn't overusing, isn't binge drinking, that they shouldn't drink. But we are wanting people to understand that things like binge drinking can lead to death. And so that's why we're looking at, you kind of see an increase in 2021, and, there's a lot of debate about why that is. Of course, that was the middle of COVID pandemic. And so, people, there's some discussion on if that was due to mental health stuff
Right.
with COVID, people were at home more and weren't going to work. So there's a lot of factors that could play into that. So, the good thing is it is trending back down on binge drinking.
Got you. And so again, for our radio audience, we're at 2020, we saw 13.1% of males and 8.4% of females who, I guess, reported that they had binge drank in the past or something?
Yes.
Is that kind of what the
and
qualifier was?
Binge drinking is, depending on the survey, I don't think this one says exactly, but usually it is someone who drinks 5 or more drinks in a short amount of time. So surveys quantify that different if it's an hour or 2 hours.
But in one sitting, I guess,
but
kind
in
of
one
a thing.
sitting, yes.
Yeah, got it.
Yep.
And so that's the 2020 number. In 2021, you mentioned it went up, and it did. 19.7 for men, 14.5% for women, or males and females, because I imagine some of these are not adults
Right.
that are reporting, they're responding to this. And then 2022, you said, and you correct that it's back down kind of to 14.5 for males and 9.8% for females compared to 2020, which was 13.1 and 8.4. So
Right.
it is trending back down, which is a positive thing.
Yes. And as we get 2023 numbers, which, like I said, they're usually a year behind, so we should maybe have them by the end of the year or the beginning of next year, we'll be able to see even more if that trends down again, as, because 2022 was kind of the end of the pandemic and things were starting to return to normal, and 2023 was more of a normal year, so we'll kind of see where that goes from there.
Right. Prior to 2020, with these numbers that we see, was it kind of flat a little bit before this spike in 2021, or do you recall?
I don't recall.
Putting you on the spot,
I
so
know.
sorry.
I apologize.
That's
I should
okay.
have looked that up, but I don't know that. But what I will plug is our data website, which is this whole sheet that we're talking about today is on there, and that is sanjuancountydata.org. And that has much more comprehensive than we're even getting into today. So
Got it.
has some of those longer term trends over, 15, 20 years that people can go look at.
Okay, and that's, again, posted online. It's available to anyone to go
Yes.
check it out.
Yep.
You put all kinds of data on there. If you're a data nerd like me, sometimes you can
Yes.
you can get in there and dig in there and see what's going on.
Yeah, and it's not just alcohol, it's mental health stuff, it's crime stuff, it's any kind of data that you could possibly want almost. And if there's a data piece out there that you want that's not on there, we have a really great epidemiologist that works on that site, and he is always willing to help us get information that we don't already have up there.
Nice, very cool. And again, a lot of that data that I appreciate is local data, and
Yes.
that's really, I think, important when you're making some of these decisions about how do we use these resources to prevent or help these folks who are having trouble with whatever it is, whether it's alcohol or opioids or anything. The data that's coming in, and a lot of times is local, not just come from the state, and so you can kind of dig down into the San Juan County level and see, what's going on here as opposed to statewide.
Well, and that's what's so important. I mean, some of these numbers are really similar to statewide, but then you looked at that first graph we looked at, and 169 versus 103. We might not see that as a problem if we were just looking at state numbers, but if we look at the county numbers, we're like, wow, this is something that is specifically an issue here that we need to address.
Right, exactly. Exactly. Good point. Good point. Amanda Evans is my guest this morning. She is here, of course, from the San Juan County Partnership. We're talking about an upcoming alcohol town hall on June 11th, and there'll be lots more information shared about that as we get a bit closer. But gosh, it's almost June, so it'll be here before we know it. Not to panic you or anything, but I know you're getting all the pieces together, right?
Yeah, we're hoping to have a flyer out that'll be posted on all our social media. We'll be boosting posts. We'll be sharing it through some different avenues and getting the word out. It'll be on our website, which is sjcpartnership.org, and our Facebook page and things like that.
Very good. And you've mentioned, I think, some special guests that are coming in as well from the state level to present at this town hall.
Yes, we have someone coming in from the Department of Health that will be able to go over some of this data. Maybe not the exact same numbers, but some of the state what they collect and things like that, and they'll even bring some local data, and so they'll be talking about it from a Department of Health kind of viewpoint and what they see and what the issues are coming up around the state.
Very good, very good. And maybe some of the state's resources maybe that they can be putting in up here to maybe deal with our unique challenges, I guess, when it comes to some of this data.
Right, and that's why we're also going to have resource tables. So we talked about kind of what prevention is, but we also have groups in the community that do intervention and treatment around some of these issues, and so we want to give them an opportunity for, at the end, people to walk around, or before we start, for people to kind of get an idea of what's out in our community and what's available resource-wise for people to learn about and maybe help themselves or a close friend or family member.
Right, very true. Let's go back to the numbers here a little bit with the partnership with law enforcement, of course.
Yes.
The partnership with law enforcement.
Right.
And that's a big part of this as well, right? To have enforcement of the laws and to make arrests for folks who are driving under the influence or driving while intoxicated, DWIs.
Right. Right. DWIs are one of the things we've been working on for many years, and we've actually seen a downward trend. You can go look on the website for some of those, but these are kind of the current stats. So 1,098 DWI arrests in 2021. And here's another one that, like, if you're comparing New Mexico to local data, 90.3 of a rate of DWI arrests per 10,000 population in 2021 versus New Mexico was only 39.7. So we do have a DWI problem, but if you're looking, we also have a lot of law enforcement that are doing a really great job on getting arrest.
Right. And even that 90.3 number is down from where it used to be. Is that what you're telling us? So, so that's positive, even though it's still above the state number.
Right.
So that's important to note. And then again, on this graphic that we're sharing, of the 19 traffic fatalities in 2022, 9 of them, about 47%, were involving alcohol.
Right. And what we know is that anytime alcohol is involved in a traffic fatality or in an accident, it's more likely to result in a fatality than an accident that didn't have alcohol. So if you have two people getting the exact same exact same accident, if alcohol is involved, it's more deadly and more likely to cause more injuries than if it's not involved.
Got it. I understand. I understand what you're saying, but I got it.
Yeah.
And many times it is not the person maybe driving under the influence that is injured or killed. It is the innocent, maybe folks in the other vehicle or what have you, or a passenger that is injured or killed.
Right, and that's why we want to, get that word out that not only is it dangerous to drink and drive, it's dangerous to ride with someone who does, and really just trying to get people to realize that even buzz drinking is buzz driving is dangerous. So, no amount of alcohol is really safe. And we just want people to realize that it may not be yourself that you kill, but it could be someone else. So
exactly. And again, and this information, the data on this page is coming from the state of New Mexico, the Department of Health, and the CDC, and some other data from your some surveys that I know the partnership does and the state does as well with youth and others in the county.
Right.
So that's important as well.
Right, and that's what's great about our data site is it's all has all the links and sources. Sorry,
all
forgot
that
my
stuff.
words.
That's okay.
But,
but links to the sources.
Yes,
and
so
things
it'll
like
tell
that.
you where the data's coming from.
Right, very, very important. And again, a big shout out to law enforcement because again, I don't think you could do the work that you all do at the San Juan County Partnership without the backup and support of law enforcement, whether it's the sheriff's office or the city police departments or even the Navajo Nation police. I mean, they're all working pulling in the same direction, if you will.
Right, they're out doing checkpoints. This weekend's Memorial Day. I promise most of the departments are going to be out doing more enforcement. Even if they're not doing checkpoints, they may be doing what's called saturation patrols,
That's
which
right.
is specifically looking for things like DWI. It's not just trying to catch anyone, but not that they won't give you a ticket if you're driving badly anyway, but
Right,
they're
right.
specifically, they get extra funding to be out there and looking for DWIs.
Right. Well, and we know that folks are going to be out on the roads traveling or visiting or whatever, recreating, which is all great. And,
Yes.
and to keep those roads safe, that's what we want, is
Yes.
more law enforcement out there. So
Yep.
we're glad that they're there, and they're good partners with you to get this message out as well. Underage drinking is another thing that we hear about a lot in the area, and so you've got data on that, and we're showing it on the screen again. This one looks like we're kind of more in line with what's going on across the state and across the nation.
We
to
are,
a certain degree.
and what we've seen is some really great trends. This shows 2009 to 2021, and you see it kind of it's not huge jumps by any means every year, but it's consistent, and that's what we want to see, is that it's going down. Because there's a line that shows the current alcohol use by youth. There's one that talks about first drink before 13, binge drinking, and drinking after driving, or driving after drinking, excuse me, and all of those are trending down, which is really good that we have that consistency.
Right. Down to about, where are we here? 14.4 is the first drink before age 13. And that, as you compare that on the left-hand side, is what we're comparing to the other stats from the state as a total and the United States. 14.4 in San Juan County. New Mexico is 17.8, so we're below the state
Yes.
average for that, and just under the national average of 15.0.
Right, and that's the reason we really care about first drink before age 13 is the younger that someone starts drinking, the more likely there's a strong correlation between age they start and if they were going to have alcohol issues later in life. So someone who starts younger is more likely to end up with a possible alcohol misuse or substance disorder later in life. And so we want to get that number. We want people to start drinking later so that they're less likely to have issues when they get older.
Right, if they're going to start at all.
Yes.
The later
Yeah.
they start, though, I guess the better prognosis it is for their lifetime.
Yes,
That
and
they
that's
won't
why
abuse it.
that's why we have things like laws that require you to be 21 to start drinking, because we do know that the brain keeps developing until age 25, and so anytime you're consuming even a moderate amount of alcohol before 25, you're doing some damage to your brain, but the younger you're starting and the longer you're doing it, the more damage you're doing.
Right, very true. And again, just to share with our radio audience, from that 14.4 percentage of the number of kids who are drinking before age 13, back in 2009, that was 30.4.
Right.
So that's double.
Yes.
In my rough math this
Yeah.
early in the morning, but
Right.
that's a pretty
Close to
good
that, yeah.
drop, right? And that's
No,
what you're
yeah.
saying, is it's showing that, and then current alcohol use has dropped again from 36.6 in 2009 to 12.3 in 2021. Binge drinking that we talked about earlier, from 23.1% in 2009 to 5 in 2021, and then again, folks who said they drove after drinking, 10.5% in 2009 down to 2.2% in 2021.
Yes.
All significant decreases.
Yep, and this is youth telling us this. This isn't us just guessing or anything. The Youth Risk and Resiliency Survey, which this comes from, is a statewide survey that youth take in their classrooms, in their schools. It's a random sampling. They do it every other year. And so they're reporting these behaviors. It's not like we're, just assuming based on numbers. So this is what they're saying they're doing.
Right, which is very significant.
Yes.
And so we hope that trend continues.
Yes.
And I guess we'll see when the new data comes out for 2022
Yep.
and 2023, and can share that as well. Next is the access to alcohol. And again, if teens don't have access, I guess they can't be drinking, but they figure out a way to get it.
I mean, I like to say I can't put myself out of a job ever because, people are going to find ways to use. But there are what we've worked on for multiple years, probably close to 10 now, is educating people on that it's a 4th degree felony to provide alcohol to minors unless they're your own child in your own home. And so that's really what we want to reduce, is the way they can get it again, they're not ever going to find it some other way, but we want to make sure that the adults in the community know that, one, it's illegal, and two, what could happen to them if they do provide it. And so that does decrease the usage if they don't have access to it.
Right. And I think it's interesting on this graphic, what we're seeing is that the access to alcohol by teens is decreasing.
Yes.
From 2019 to 2022. You had 81% saying it was very or somewhat easy. And then by 2022, only 73% said it was very somewhat easy. So that's a small drop, but still
Yes.
it's getting harder, I guess.
Yes.
To find it. And then social access to alcohol was given to me, and that's 47% in 2017 down to 41% in 2021.
Right. And so that's, again, the harder we make it for them to get it, the harder it will be for them to drink. And so that's what we want.
Right. And from that pie chart, we can see that is the number one way that teens say they got alcohol that was given to them.
Yeah.
And that is the largest slice of that pie, if you will. The other ones are they got it some other way. They took it from a store or a family member. They gave money to somebody else to get it for them. That's 15%. And then what I think is also significant is the 0% in this chart, right? Got it from a restaurant or bar, 0%. Got it at a public event, 0%. Bought it in a store, 0%. And that's been a lot of education as well, I think, that the partnership's been involved with to try to teach the retail establishments and the clerks and the restaurant workers or bar workers, how not to serve to an underage person.
Right. And that's really, we spent several years doing extra trainings because servers always have to go through a statewide training before they can have their license to serve alcohol. And so what we wanted to do is just really reinforce with them, one, the consequences on them, because it is a 4th degree felony for them, so they can face fines and jail time. Most of the time, whatever business they're working for is going to fire them on the spot if they get a citation. And then, again, the dangers to our youth about why they shouldn't. And so, those 0%, not that it never happens by any means, but it really is telling for how well our community does on for the most part, on not providing, not selling it.
Right. Right. And again, this is local data. This is
Yes.
San Juan County data,
Yes.
not statewide data. So
Yes.
we can definitely see that. And that's an important thing as well. And then the final chart I think that we want to share to everyone is about the success of prevention.
Well, yeah. So, that's one of the great things that we've really seen is that some of these programs are working, and it's by no means just the partnership. It takes a community effort. We have other agencies in the community that do work around this. Again, we have partners in law enforcement. So it's not just us, but we have done, like I said, a 4th degree felony campaign for many years. And so we're seeing 76% of community respondents are aware that it's a 4th degree felony now. And so, and that's increased. This one says 74% in 2019. And again, that, if you go back further, those numbers may be lower. So we're really trying to just get that word out and get people to understand what the consequences are. And there's still going to be people who may choose to make that choice, but at least we want them educated around what could happen if they do.
Right. Now, this is, again, it was a state law change that made it a 4th degree felony, right, for an adult to provide alcohol to a minor.
Yes, and this has been this way for many, many years now. I don't know exactly when it was changed, but it's been over 10 probably since. And so it is a 4th degree felony. They can face fines and jail time if they do provide. And again, it's not their own child, so they do have a right. If you're in your own home and you're serving your own child alcohol, you have that right. But if you're serving a niece, a nephew, a cousin, a friend, that you don't have that right. So it has to be your own child. You have to have legal guardianship. There's lots of rules around that, and there's a few other exceptions. But for the most part, if you serve anyone but your own child, you're committing a 4th degree felony.
Got it. And again, 76% of folks who replied to that survey understand that.
Yes.
And so that's a good thing.
Yes.
So very good. Well, Amanda, we are almost out of time this morning, but I think this has been a really great program to talk about and show a little bit of the ways that the San Juan County Partnership helps to kind of make some of these important changes to some of these things that we see impacting our community every day.
Right. And so we've had a really big focus on youth for many years, and we've seen some downward trends on that. And so now we're talking about some adult issues too, and we hope we can kind of start curving that down. And so this town hall is kind of just a first step in getting some community conversations going around what are the issues and how might we address them.
Exactly. And again, that's coming up on June the 11th.
Yes.
And there'll be more information coming out here in the next couple of days, I would say.
Yep. June 11th, the Boys and Girls Club, 6 p.m. Look on our Facebook and our website for the flyer that'll be out in the next day or so.
Okay, very good. Thanks so much for coming in this morning.
Thank you for having me.
You're very welcome. That's Amanda Evans from the San Juan County Partnership, my guest right here on KSJE.
Help wanted on Mars.